to today's Human Angle of the Coronanomic series. It's the International Nurses Day and the 200th anniversary of Florence Nightingale's birth. International Nurses Day is an annual event celebrated around the globe on May 12th each year, saying thank you to the contribution that nursing staff make to the lives of people every year. International Council of Nurses has celebrated International Nurses Day since 1965. In January 1974, 12th May was chosen as the day to celebrate the occasion since it's the anniversary of the birth of Florence Nightingale, the founder of modern nursing. Although International Nurses Day is celebrated globally on the anniversary of Florence Nightingale's birth each year, this year marks the 200th anniversary of the nurse's birth, and it's also the International Year of the Nurse and Midwife. Dr. Krista Oldman, Chief Executive of community nursing charity, the Queen's Nursing Institute, of which Florence Nightingale was one of the founders, told Nursing Times, "We are working in extraordinary times and you are doing an extraordinary job to protect the health of people, families, and communities everywhere." Today, all nurses working in the community are demonstrating that the need for excellent community nursing is as great as ever, and its opportunities are only growing as we adapt to today's challenges. Prime Minister Boris Johnson has marked the anniversary by releasing a video tribute to Florence Nightingale on Twitter. In the video, Mr. Johnson said, "Florence Nightingale, author, data scientist, and above all, the pioneer of modern nursing, would go on to change the world forever. She revolutionized Victorian healthcare, establishing principles that stand to this day. She changed and shaped the very perception of what a nurse is, what a nurse should be, transforming the job into what she called the finest of fine arts. And in doing so, she saved lives, not just in her own lifetime and her own country, but for decades to come and in every corner of the globe." Today, from ProShare and the WebTV Human Angle, we support nurses and midwives by celebrating their bravery, kindness, and dedication. Also, we recognize all the health workers who are at the front line of ensuring that the adverse impact of COVID-19 is mitigated across the globe. Nurses are on the front line battling COVID-19. On this International Nurses Day, let's show our gratitude by doing our own part and following public health advice from WHO and national health authorities. We go further with the story that a senior health official set to testify before the U.S. Senate would warn legislatures about risks of reopening the economy too soon, saying it could lead to needless suffering and deaths, according to the New York Times. Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases and a leading member of the White House Coronavirus Task Force, will make his case even as President Donald Trump is pressing states to lift lockdown measures, saying people are dying even in the lockdown position too. Fauci would appear before the Congress remotely today. 1 in 6 healthcare centers around the world lack safe hand-washing facilities, and nurses at the front line of the fight against the coronavirus pandemic are struggling to wash even their own hands, an international aid group has warned. As the world celebrates International Nurses Day today, the Water Aid Group said nearly half of all healthcare facilities in the poorest countries do not have clean water available. This has resulted in 1 billion people being forced to seek care where there is no clean water. Doctors and nurses are on the front line of the coronavirus outbreak that has killed nearly 286,000 people and infected more than 4 million worldwide. Many healthcare workers have died after contracting COVID-19, the disease caused by the coronavirus. Today is the International Nurses Day, said, and it's a time really to encourage and help our nurses in their fight against the coronavirus. Thousands of healthcare workers in developing countries are facing down this crisis with no clean water or soap to wash their hands. Tim Wainwright, Chief Executive of WaterAid, said in a statement. Denmark will significantly increase testing and put a contact tracing system in place to prevent a second wave of infections, Prime Minister Mette Frederiksen said. If the virus reignites, we need to know in time. This is why we need an effective tracing of the virus spreading, Frederiksen told reporters. We need to isolate the sick so we can break the infection chains without having to close down society again, she said. Austria's National Soccer League, the Bundesliga, will likely restart matches in the first week of June, a senior official said. The match schedule will likely be discussed at a meeting on Wednesday, the league's chief executive Christian Ebenbohr said at a news conference in Vienna. Several coronavirus patients were killed and about 150 evacuated after a fire incident in the intensive care unit at a hospital in Russia, according to the country's emergency ministry. The St. George Hospital in St. Petersburg, where the incident happened today, said it would stop using the Aventa Elm model of long ventilators until the criminal investigation into the cause of the fire was completed, the TASS news agency reported. Unfortunately, we weren't able to save 5 people, said Alexei Alkin, the head of the emergency services branch in St. Petersburg. Earlier, local media reports cited unnamed sources from the ministry saying that the cause of the fire was overloaded ventilators. Ventilators are their limits according to preliminary data where there was an overload and the machine ignited, which caused the fire, a source told Interfax news agency. Spain has ordered a 2-week quarantine for all overseas travelers coming to the country for May 15th. Travelers will have to remain locked in and will only be allowed to exit for grocery shopping, go to health centers, and in case of situation of need, an official order said. The quarantine has been forced for all travelers incoming to Spain between May 15th and May 24th, when the state of emergency is due to end. The UK government will set out details on how to make workplaces safer as some businesses start to return to work after Prime Minister Johnson set out a plan on how they exit the lockdown. Health Secretary Hancock said the business ministry would set out details. We work not only with employers but also with the trade unions who last night called what we are coming out with a step forward, Hancock said. The International Red Cross and Red Crescent movement and the International Council of Nurses are calling on governments to commit to ensuring the protection and safety of nurses and other health workers, especially in resource-poor disaster and conflict settings. The organizations say healthcare workers' health and safety is vital for a competent medical response during the coronavirus pandemic. This was part of the key statements of the organization in commemoration of the International Nurses Day. The pandemic has seen frontline nurses rightly recognized as heroes, but they are also ordinary mothers and fathers with their own families to protect, International Council of Nurses President Annette Kennedy said in a joint statement issued by the organizations. He also said they deserve to be able to walk free from fear, whether because of a lack of PPE or because of harassment and attack. All mosques in Iran are to reopen temporarily today, the official IRIB news agency reported. The decision was made in consultation with the Ministry of Health. IRIB quoted Mohammad Komi, the director of the Islamic Development Organization, as saying yesterday that mosques would only be open for 3 days, commemorating specific nights during Ramadan, and it was unclear whether they would stay open, according to the Fars news agency. The move comes even though some parts of the country have seen a rise in infections. Indonesia is rolling out rice ATMs in a bid to ensure those worst affected by the coronavirus outbreak can get the foods they need to survive. The vending machines are packed with rations of good quality rice and operated by magnetic cards. Each day, we prepare 1.5 tons of rice for around 1,000 residents, said Ibrahim, an army official supervising distribution in a military camp on the outskirts of Jakarta. Speaking to Reuters, the military officer said, "We will continue doing it every day without rest. Even on weekends, we will distribute non-stop." 10 machines have been set up in the capital with daily wage earners, the unemployed, those who do not own a house, and people who live below the poverty line eligible for the rations. Brazilian President Jair Bolsonaro has declared gyms and hair and beauty salons essential services, allowing them to remain open despite the coronavirus lockdown. Right-wing leader Bolsonaro has been a vocal opponent of the lockdowns imposed by state and municipal governments across Brazil, despite the mounting number of cases and deaths. The question of life has to be taken in parallel with jobs, Bolsonaro said yesterday outside his official residence. Without the economy, there is no life, there are no doctors, and there are no hospital supplies. President Muhammadu Buhari has directed the airlifting of Nigeria's allocation of the Madagascar syrup, reportedly effective for the COVID-19 treatment. The Secretary to the Government of the Federation and Chairman of the Presidential Task Force on COVID, Mr. Boss Mustafa, disclosed this yesterday in Abuja at the 29th Joint National Briefing of the Task Force. The SGF said the syrup will go through the necessary validation before it's used in the country. President of Madagascar, Andry Rajoelina, had 3 weeks ago officially launched a locally produced medicine he believes can prevent and cure patients suffering from COVID-19 ailments. Nigerians' current confirmed COVID-19 cases is 4,641, while the number of recoveries is 902, with 150 deaths announced. Total sample tests carried out at the moment are 28,418. Lagos continues to lead the number of cases with 1,933, followed by Kano 666 and the FCT Abuja 359. States with the lowest cases are Abia with 2, Benue with 2, and Anambra with 1 case. Kogi and Cross River states are still yet to record any COVID-19 case. And that will be all for this edition of The Human Angle. You can send your videos and pictures to news@polshareng.com or programs@polshareng.com, and let's share your experience and views. Visit our website www.polshareng.com to get more updates from our news stories and videos. Also follow our social media platforms showing on the screen for further updates on our market reports. Join us by 9 p.m. for our night segment, which will be streamed live on our YouTube, Facebook, and Twitter channels. Till tomorrow, thank you for watching and do stay safe.